Mr. Williams' Neighborhood, hip-hop mechanic, gardener guy, unreasonable Daria fan. Let's get right down to the funky stuff. Taking a look over here, as measles surged in Texas earlier this year, the Trump administration's actions sowed fear and confusion among CDC scientists, Center for Disease Control, and it kept them from performing the agency's most critical function, emergency response. That's good. The outbreak soon became the worst the United States has endured in over 3 decades. In the month after Donald John Trumpelstiltskin took office, his administration interfered with Centers for Disease Control and Prevention communications and stalled the agency's reports, censored its data, and abruptly laid off staff. In this chaos, the Center for Disease Control was a little out of control, and the experts felt restrained from talking openly with local public health workers, according to interviews with 7 CDC officials. Not several, 7, getting specific here. These officials had direct knowledge of events as well as local health department emails obtained by the folks down at KFF Health News. And this came through public records requests. You know, back when I first started podcasting, and I'm going to use the K word here, okay? And not some stupid anti-Semitic shit, the other K word. When I first started podcasting, a recurring message, maybe like every 2 months or so, was like, yo, if anybody ever runs and they're saying shit about getting rid of public records requests or what is that shit, FOIA, Freedom of Information Act requests, kill them. Just kill the motherfucker. Just do it. All right? Now, Trumpelstiltskin didn't run on it. James David Vance didn't run on it. None of these fools ran on it. But one would think that if you are legislatively aware, judicially aware, and executive branch aware, you would know that the folks of the Neo-Confederate Republican Party were heading in a direction like this. But apparently to a great many of you, every single representative and every single voter of both parties are exactly the same. Dylan Roof, you see as exactly the same as Jasmine Crockett. Somehow, that's logical in your head. You're an adult. Now, continuing, we have a quote, from Catherine Wells. And Catherine Wells is the public health director in Lubbock, Texas. Lubbock. I've never heard anyone say it out loud to me that's from Texas. And Catherine tells us, quote, "The CDC hasn't reached out to us locally. My staff feels like we are out here all alone." End quote. A child would die before CDC scientists contacted Wells. Wells further tells us that all of us at the CDC trained for this moment, a massive outbreak. All this training, and then we weren't allowed to do anything. End quote. Delays have catastrophic consequences. When measles spreads in under-vaccinated communities. And like many in West Texas, they're under-vaccinated communities. It's not great. If a person with measles is in the same room with 10 unvaccinated people, 9 will be infected. This is an estimated by nerdy-ass researchers with their pocket protectors and their little notepads and their little Palm Pilot and whatever the fuck it is the nerds are carrying around now. They did the research. They published the research. I'm just some hip hop mechanic gardener guy reading it. All right? I'm not a brilliant McGenius. They are, and they know their shit. Follow the nerds. What happened? I swear to fuck, it used to be a culture where somewhere you kind of understood that it was a better idea to listen to Daria than it was to listen to Kevin. You know? All right. So, if those 9 people go about their lives in public spaces, numbers multiply exponentially. You know, the whole math thing. Numbers. The outbreak that unfolded in West Texas illustrates the danger the country faces under the Trump administration as vaccination rates drop, misinformation flourishes, public health budgets are cut, and science agencies are subject to political manipulation. While the Trump-Stiltskin administration stilted CDC communications, Health Secretary, here we go, Captain McFucking Brainworms over here, Robert F. Kennedy Jr., the one Kennedy that no one seems to be able to, do the whole Kennedy thing. This family has a legacy. Somebody? Rittenhouse? Shit. Alright. So, Health Secretary Robert F. Shit for Brainworms fueled doubt in vaccines and exaggerated the ability of vitamins to ward off disease. Vitamins. Stupid shit. Irresponsible shit. Very, very irresponsible. And I understand, the nerds, they put this article together. It's not just Robert F. Kennedy. It precedes Robert F. Kennedy. Hell, it precedes what some might call modern medical science. It precedes that. This anti-vaxxer shit has been going on, and, particularly with people of this Western culture descent. Right, the progenitors of Western culture have always had a sort of, well, I don't want to prevent disease attitude, and again, I feel like, yeah, I'm gonna say feel. It's emotional. I feel like I'm the only one that remembers very basic shit from elementary school, and as more accurate information came into my developing brain, I was able to extrapolate that base information into what one might call a broader understanding. And this is why I really point to that Western shit, because something very basic that I remember from elementary school, Camas Prairie, Spanaway, 176th Street. I was right there. And we learned that the indigenous folks, they called them, remember, we were being taught by boomers and their parents. Remember, I was going to school in the late 80s, early 90s. People that were born in the 1930s were still teachers. In the 1940s were still teachers. People that were also born in the 50s and 60s were coming into teaching as well. All right, but I was being taught by old-timey fuckers, and they're like, Indians, and then to them, Native American was progressive language. But they would tell us, they're Native McMurricans. They would take something like a little piece of old feces from a bat or some shit, and with a little stick, and just kind of scratch a kid's arm, and children would be lined up and you scratch their arm with it, and that would vaccinate them against catching some shit from it or from that animal in the area that season. They were vaccinating It was just pragmatic. It was logical. And they came about it without Western intervention, Western medicine, Western scientific breakthroughs. The West has a big problem with the nerds have the great ideas, and I'm going to use the J word here, and the jocks take credit for them while also dismantling institutionalization of those ideas because they're fucking stupid. Like, the stupid people always come out on top in Western culture. God, darling. Okay. Dancing forward a little bit more. The Texas outbreak, it spread to New Mexico, Oklahoma, Kansas, Colorado, and Mexico's Chihuahua state. I didn't know that existed. And that was at a minimum. Together, these linked outbreaks have sickened more than 4,500 people, folks. And it killed at least 16 of them motherfuckers. Which is very pro-life. It's very, very pro-life. It also levied exorbitant costs on hospitals, which is very pro-budgeting. You see, you gotta run the government like a household. It also put these exorbitant costs on health departments and those paying medical bills. Right? So if you're one of these fucking little punk ass, little skinny ass, little fucking libertarian boys running around the city with your little fucking shorts and your little New Balances, and you're like, I shouldn't have to pay for fat people. No, it wasn't fat people that made your costs go up. It was anti-vaxxers, stupid. It was your own side. Your own side cost you all the money. Kind of like how your side is capitalist and nepotism, right? Capitalist and nepotism is your side. Well, you hate welfare, don't you, skinny punk ass libertarian boy? Jogging around in your little shorts? Well, if Walmart would pay a thriving wage, Walmart wouldn't be the biggest recipient of welfare. Remember, it's Walmart, not the Walmart workers. Under capitalism, which you love, the workers did their part. They worked. Walmart doesn't kick out a decent enough check to where Walmart doesn't need welfare to sustain its units of labor. If you will. Fucking libertarians. Continuing. An individual by the name of Jennifer Nuzzo, N-U-Z-Z-O, pronounced it perfect. Jennifer Nuzzo is the director of the Pandemic Center at Brown University because she's a fucking nerd and you should listen to her. And Jennifer says, "This is absolutely outrageous. When you are battling contagious diseases, time is everything," end quote. Now, we'll be going back to quotes from Wells. All right, we heard Catherine Wells earlier. And Catherine Wells, under this section, the CDC is stressed currently. Wells was anxious the moment she learned that 2 unvaccinated children hospitalized in late January had the measles. And hospitals are legally required to report measles cases to health departments and the CDC. But Catherine Wells was worried many children weren't getting tested. And she says, quote, "I think this may be very large." And she further says in another email, "According to one of the women I spoke with, 55 children were absent from one school on January 24th. 50 fucking 5 absent on the same day." I don't know what kind of schools you went to, but for me, K through 12, 55 absent on the same day is gonna cause a little chatter. And they were showing symptoms as early as November. Oh, holiday season. When all the people get together and get in close proximity. Right? Like, if you're in the Midwest and you're COVID conscious, as soon as you see the words chili cook-off, if you have some vacation or sick hours saved up, here's what I would do and all. 2 weeks after the chili cook-off is scheduled, use those hours for 1 week so that all the people who went to the chili cook-off can finish spreading their shit and then be stuck home for a while sick while you come back to work a little later. Right? Right then. Continuing. In that email by Catherine Wells and others, she asked state health officials to put her in touch with CDC experts who could answer complicated questions on testing, how to care for infants exposed to measles, and more. What transpired was a plotting game of telephone. One email asked whether critics would decontaminate rooms where people with measles had just been if the clinics were too small to follow the CDC's recommendation to keep those rooms empty for 2 hours. And she also wrote to them on February 5th asking, would it be possible to arrange a consultation with the CDC? End quote. An individual by the name of Scott Milton. Scott Milton is a medical officer at the Texas Health Department. And about 25 minutes later, he said, it never hurts to ask the CDC. End quote. Well, that's helpful. He further says, I asked him to escalate this question to someone more qualified. Of course, we know the CDC is stressed currently, end quote. Well, local officials resorted to advice from doctors and researchers outside the government, including those at the Immunization Partnership, a Texas nonprofit. And Terry Burke is an executive, is the executive director of this partnership, and Terry Burke tells us the CDC has gone dark. We had anticipated a measles outbreak, but we didn't expect the federal government to be in collapse when it hit. I gotta tell you, well, which party was in office? Was it the party that has been running on dismantling the government ever since they lost the Civil War? Was it that party? Was it the Neo-Confederate Party? Oh, well then, welcome to my unsurprised face. Continuing. Technically, the Trump administration's freeze on federal communications had ended February 1st. However, CDC scientists told the folks down at KFF Health News that they could not speak freely for weeks after. Quote from an unnamed scientist, a nerd. They said, there was a lot of confusion and non-answers over what communications were allowed, end quote. That's exactly how they spoke, too. Now, we have George's Benjamin. To me, I wonder if that's supposed to be Jorge's. I don't know. But George's Benjamin is an executive director of the American Public Health Association. And he said the situation was not unique to the measles. He said, quote, like most public health organizations, we weren't able to get a hold of our program people in February. He further tells us that that the information merely trickled out through the CDC's communications office, but CDC scientists gave no press briefings and went, what's that word? Dark, in their closest partners across the country. And to put a fine point on it, a closing quote from that segment is, the CDC was gagged, end quote. Through private conversations, Benjamin further learned that CDC experts were being diverted to remove information from websites to comply with executive orders. Now hold on, before anyone gets surprised, these were executive orders from a president representing what party? Which party? Which party is it? Because I gotta tell you, I look over here and I see that there are two viable parties on the ballot. And one of them, they seem to agree with me here and there. Don't seem too great. And then the other one is fundamentally against me, fundamentally against my wife, fundamentally against my niece. The people that vote for their party make jokes about my biological mother's death. The people that vote for their party, they make it very clear that they would like to lynch me. And I kind of look at those two parties and I think, I wonder if there's anything about them that makes them 100% down the line exactly the same. And so I look at the recent history of my lifetime of those parties, and one of them does shit like this, and one of them, while not being 100% aligned with me and my perfect little tooth fairy party, they don't do shit like this. And so I pick the party that doesn't do shit like this. And then I go in and I perform the very simple task of casting a ballot against the party that does shit like this. You know, but then again, I understand. There's going to be people in the comments that are like, nope, still the same somehow. I'm a genius contrarian. Okay. All right, Bucko McSchmucko. Continuing. To work on the ground, the CDC needs an invitation from the state. But Ann Shushat, some names coming up here. But Ann Shushat, a former CDC deputy director, she said that during her 33 years with the agency, federal health officials didn't need special permission to talk freely with local health departments during outbreaks. Quote, we would always offer a conversation and ask if there's anything we could do, end quote. Now, another person pops up here. The press officer with the Texas Health Department, Laura Anton. And Laura Anton comes in with some information for us. And she says that the state never prevented the CDC from calling county officials to learn more about the state's correspondences with the CDC. The folks down at KFF Health News filed a public records request to the Texas Health Department. The department refused to release the records. Oh, God, gee willikers. I wonder which party is in this, little institution making these refusals. I gotta wonder. You know what? They're both exactly the same. It was probably the demon rats, right? It was the shit libs that did that. It had to be, because they're both exactly the same. That's how that goes, right? Right. Continuing. Anton called the records, quote, confidential under Texas Health and Safety Code. Okay. Anton said the state sent vaccines, testing supplies, and staff to assist West Texas in the early weeks of February. And that's corroborated in emails from the South Plains Public Health District, which oversees Gaines County. But now they're seeing some losses. They should be Losses County. And this area was hit the hardest by the measles. And they did not gain 16 more citizens. I tell you that. Zach Hallbrooks is the health district's executive director. And he tells KFF Health News directly, quote, Texas will try to handle what it needs to before it goes to the CDC. End quote. Responding to an outbreak in an under-vaccinated community, however, requires enormous effort to keep numbers from exploding. Public health workers ideally would notify all people exposed to an infected person and ask them to get vaccinated immediately. if they weren't already. If they declined, officials would try to persuade them to avoid public spaces for 3 weeks so that they wouldn't spread measles to others. Oh, I gotta tell ya. So you're trying to tell these selfish, entitled people to just think of people other than yourself. Think of people that may be entitled to life, liberty, health, and happiness outside of yourself. Good luck telling a progenitor of Western culture that. Continuing, this individual, Hallbrooks, they said that it was nearly impossible. Cases were concentrated in a close-knit Mennonite community. Religion. You gotta love when a cult gets big enough that it's respectable, and now it can be a 501c3 religion now. That's great for cults. You see, the thing is, if you're gonna be a cult leader, go big. Then you don't have to pay taxes. So, this Mennonite community is where people relied on home remedies before seeking medical care. He said many people didn't want to be tested, didn't want to name their contacts, didn't want to talk with the health department. It doesn't matter what resources I have if people won't avail themselves of it. End quote. Historically, Mennonites, bullshitters and bad faith actors, and probably a bunch of, I'll just say it, why code word it, pedophiles. That's the main reason that people start cults, is because men want to ejaculate in children. That's the primary reason that cults get started, is there's a man or a group of men that really want it to be socially acceptable that they ejaculate in and or on children, so they start a cult to make it acceptable within the cult. If the cult gets big enough, it's a religion, and then everybody knows that men in this religion, no longer a cult, regularly ejaculate in and or on children, and everybody just kind of rolls with it. Every single person, it's Wednesday right now, in a couple days, a bunch of people are going to go into Catholic church buildings knowing that men in this building, that men in this community, that, what are they called, a parish, a Catholic parish, whatever, this parish, this district of Catholicism, that there are men ejaculating in and or on children under the precipice of this cult religion, and that money that they put in that offering plate, they're going to put money in that offering plate, and it's going to go to lawyers that are going to keep these men out of prison and shuffle them to other districts so that they can ejaculate in and or on other children. They know that's happening, and they're gonna do it anyway. This Sunday, a bunch of Catholics are going to provide funding for the child ejaculating on culture, if you will. Let's be realistic about what this shit is. Let's not be silly people. Now, I'm gonna upload this joint and put a link to this KFF Health News article that you may take a look at yourself. And there was another article that's probably covering a gang of the same shit, but I'll link the Los Angeles Times as well. Check them out. Give it a read. Reading is fundamental. And not joining a cult or supporting one, no matter how big and respectable it is the way to go. Stay away from the cults.
Handicap zone, I'm like, please listen to my rap song. The cash gone for the full metal jack. Mash like the gas pedal flat to the flow. Stole the ghetto back from the opponent. G-O-D for G's only. It's like, damn, it feel good to see people up on it. Every nuisance with his 2 cents to the brain like a lucent. Nogenic silent firearms on the lawn of tennis. Blast like Jerome Bettis, off the line of scrimmage. In the photo, Plymouth too fast for photo finish. Can't see me, Pee Wee, first string phantom on screen pad.